everyone. I'm Dr. Rob Van Bergen. Welcome to our Sana Institute 10-minute training, and happy Friday to everyone. Today, I want to introduce the Hache Protocol Reset to those of you in this community and talk about why this 90-day reset program is able to help you in your practice. Now, this process in this program is designed to naturally alleviate chronic pain, to reduce inflammation, and to enhance overall well-being. All, of course, without relying on drugs, surgeries, or any kind of nasty invasive procedures. So the Hache Protocol empowers individuals to reclaim their health while also offering practitioners a unique opportunity to expand their practice. Now, as a functional medicine practitioner, you're committed to treating the root causes of chronic conditions, not just the symptoms. That is the whole piece of functional medicine. The Hache Protocol Reset aligns seamlessly with this mission because it provides your patients with actionable, self-guided plans to achieve sustainable results. But it does go beyond this as well. Now, the reset is structured around our 5 interactive elements. The first is, and in no particular order, stress reduction. We all know that stress is a key factor that can negatively impact multiple systems in the body, including the immune, hormonal, and cardiovascular systems. Functional medicine emphasizes the importance of identifying the root causes of stress and supporting the body in managing its effects. And stress reduction techniques such as mindfulness, meditation, and breath work, these all help to balance cortisol levels. We know that stress can elevate cortisol, and this leads to adrenal fatigue, to immune suppression, even to weight gain. So stress management strategies help restore healthy cortisol rhythms. We also know that it supports immune function. Reducing stress will enhance the body's ability to fight infections and to fight them correctly, even in the cases of dysfunctional immune systems. As chronic stress begins to impair immune function, we need to deal with the stress to cease that impairment. It will also work to improve mental clarity and emotional health. Decreasing stress can reduce anxiety, reduce depression, reduce brain fog, all while enhancing focus, mood stability, and mental clarity. And for those people that are suffering with hormonal issues, stress management could support the regulation of these hormones, whether it be insulin, thyroid hormones, sex hormones. Contributing to overall hormonal balance by reducing stress is key. Next is sleep enhancement, and functional medicine does recognize the vital role of restorative sleep in healing and maintaining health. We know that poor sleep quality is associated with just numerous health issues, including inflammation, metabolic disorders, and mood disturbances. Sleep optimization through lifestyle changes like sleep hygiene, aligning your circadian rhythm, even relaxation techniques, and of course, the addition of microcurrent techniques as well, all offers multiple benefits. One of these benefits would be cellular repair and detox. Sleep allows for the restoration and repair of the tissues and the regulation of immune function, as well as the detoxification processes that occur during deep sleep. We also see improved cognitive function. Quality sleep enhances memory, learning, and cognitive performance. It also supports emotional regulation, reducing stress and anxiety levels. It also contributes to hormone balance. Sleep is crucial for maintaining healthy hormone levels, including those that regulate appetite, as well as the cortisol hormone stress. And it's important for your metabolic health. Chronic sleep deprivation is linked to issues like insulin resistance, weight gain, and even increased risk for metabolic disorder. So adequate rest here helps to regulate metabolism, and it supports healthy weight management. Nutrition is obviously key. It's one of the biggest things that alternative health does differently than conventional medicine. Nutrition is foundational when it comes to overall health, because proper nutrition is not just about the quantity of food consumed, it's not just calorie counting, right? But also about the quality, the nutrient density, and how foods impact inflammation and gut health. Key approaches would include a reduction of inflammation, right? Anti-inflammatory diets, and remember, there's no one-size-fits-all diet, all rich in omega-3 fatty acids and antioxidants and fiber. These can help modulate systemic inflammation, which contributes to almost every chronic disease, but with heavy emphasis on things like heart disease, autoimmunes, diabetes. Gut health, of course. Nutrition plays a pivotal role in gut health, and a balanced diet can help restore the gut microbiome, which in turn supports digestion, nutrient absorption, and proper immune function as well. And then hormonal support. Yes, nutrition also is important for this too. So nutrient-dense foods can help regulate your blood sugar, the insulin, cortisol levels. All of these are important. And good nutrition even helps with your mental health and cognitive function. This can boost serotonin production, it can stabilize blood sugar, and it can provide essential nutrients for brain health, supporting the emotional stability of the individual. The fitness piece is also important too. Physical activity is integral to a holistic functional medicine model. Regular exercise has a bunch of benefits. Enhanced circulation and detoxification, right? We know exercise improves blood flow, which promotes the delivery of nutrients and the removal of toxins. So this is very important for anyone dealing with chronic issues. Musculoskeletal health, we know that regular movement and strength training help maintain muscle mass, bone density, and joint health, preventing age-related decline and injury as well. Improve mental health. You can see how all of these are connected, right? Physical activity will release endorphins and other neurotransmitters. We've even seen that some evidence shows that symptoms of depression can be resolved more by exercise than they can by any kind of medication. Exercise obviously helps with weight management. It helps to regulate your metabolism. It burns off excess fat, and it supports lean muscle mass. Again, if you can maintain a healthy weight, chronic pain issues are going to be less problematic, as well as metabolic diseases. And regulation of hormones. Here we go again. Exercise helps balance these key hormones such as insulin, leptin, the growth hormones, and it can reduce the risk of insulin resistance as well. Now, microcurrent comes in here and ties all of this together, because with the addition of microcurrent, you can help each of these other elements to succeed. With a reduction in inflammation, enhanced ATP production, and complete control over the nervous system as a whole, this can be a silver bullet for any patient. And those who are incorporating the other elements into their plan will be poised for success. So whether you are not doing all of these other things, there's still going to be a lot of benefit with microcurrent, but those that are have a body that is supercharged and ready to go. Now, for functional medicine practitioners, integrating the skills and knowledge from the reset can provide a guided process that can really significantly enhance patient care. Each of these elements is fundamental in resolving underlying issues and in building a foundation for this overall healthy life. By adopting this holistic approach, practitioners can address the root causes of chronic pain and inflammation, and this offers patients a natural and effective path to recovery. The program's emphasis on microcurrent therapy as well does provide this additional tool for pain management. It aligns with the principles of functional medicine. It's giving us something that can resolve disease, it can correct the body electric, and in turn, it can fix what ails you. Now, the Hache Protocol Reset does also offer practitioners a way to grow their practice. I mean, you can utilize the program in your own practice independently. So you've taken the program, you have access to the resources, and you can start to issue some of these resources out there. Or you can even refer patients to this program, and you can earn a referral fee for doing so. And it's not a small one either. It's pretty simple. If you share the Hache Protocol Reset with your patients, when they enroll through your sharing referral link, you will receive 50% of the course fee. This does not include the devices, but is 50% off the course fee. So not only are you then empowering them to take control of their health, but you're also creating a new revenue stream for your practice. Some people will wonder, well, what happens when the person enters the Hache Protocol Reset if they're my patient? How does that work? Well, students in the reset who've received practitioner guidance in the past, they've gotten better overall wellness results. It's all about accountability. It's about having that person to talk to and work with. Your patients will also feel more connected to your methodologies, improving their results drastically. So for patients to have a built-in program that they can work on with your support and with ours if needed, they're really getting this cohesive community support process that's just going to empower them to resolve their issues. And it's going to enable them to feel that they have some control over these things on a larger scale. So ultimately, when you go to integrate the reset into your practice, you're kind of enhancing patient outcomes and you're building a sustainable partnership with us here at Pain Free for Life. And this program is going to equip your patients with tools to thrive and support your practice with the financial rewards as well. So if you do want to learn more about the reset, you can check it out at the Hache Protocol Reset.com. All right, everyone, thank you so much for joining me today. I hope you all have a wonderful weekend, and I will see you next week for our next 10-minute training. Take care.